Okay, today let's cut straight to the chase on something really vital for your health. We're talking about pneumococcal vaccines. We want to dive deep, get right to what's important, so you feel really well informed.
Absolutely. And what's truly remarkable is the impact these vaccines have. They're not just another shot. They actively shield you from serious bacterial infections.
Serious ones, right?
Yes, caused by pneumococcus.
Yeah.
We're talking things like pneumonia, meningitis. That's a really nasty brain infection, even bloodstream infections. And for some people, this protection is, it's absolutely crucial.
Okay. So when we talk about these tools, there are basically two main kinds you hear about.
That's right. You've got the pneumococcal conjugate vaccines, the PCVs, and then the pneumococcal polysaccharide vaccine, which is PPSV23.
PCVs and PTSV23. Got it.
So the PCVs, they're generally designed for broader, often longer-lasting protection. It's actually quite an evolving field. We've had older ones. Now there's PCV15, PCV20.
And I heard there's even a newer one.
Yes, PCV21 or Capvaxive. Very new. The trend is definitely towards covering more strains, like upgrading your protection.
Okay, so better shields. What about the other one, PPSV23?
Right, PPSV23, Pneumovax 23. It covers a different set, 23 types actually. And it's often used sometimes in combination with the PCV. Depends on the situation.
Okay, so we have these different vaccines, but the real question I think people have is, which one do I need and when? Let's try and, untangle the vaccination schedules. It sounds like it might have gotten simpler.
It has, actually. For many people, it really boils down to your age, your health status, and importantly, what pneumococcal vaccines you might have had before.
Right. Makes sense.
So let's connect this, maybe start with adults who've never had any pneumococcal vaccine. What's the advice there?
Yeah, good starting point.
Well, for most adults aged 50 or older, it's often quite streamlined now. They'll typically just get a single dose, either PCV20 or that new one, PCV21.
Just one shot.
Often, yes. That's a big advantage. For many, that single shot means you likely won't need any more pneumococcal vaccines down the line.
Okay. That sounds much easier. Is there an alternative?
There is. Some might get PCV15 first, and then that's followed by a dose of PPSV23, usually at least a year later.
A year later, right.
Although for certain health conditions, that gap can be shorter, sometimes as little as 8 weeks.
Right. You mentioned specific health conditions. What about younger adults, say under 50, who have those?
Excellent question. Yes, for adults aged 19 up to, 49 who have certain health issues.
Like what sort of issues are we talking about?
Things like chronic heart disease, lung or liver disease, diabetes, conditions that weaken the immune system, or even having a cochlear implant or CSF leak.
Okay.
For those individuals, the recommendations are pretty similar to the over 50s. It's likely a single dose of TCV20 or PCV21.
Or the other option?
Or, yes, the PCV15 followed by PPSV23. And again, for this group, because of their higher risk, that interval between PCV15 and PPSV23 can be just 8 weeks if needed.
Okay, this is getting clearer, but here's a really practical point. What if someone listening has already had some pneumococcal shots in the past, like the older ones?
Yeah, that comes up a lot.
Are they all set, or do these newer vaccines change things for them?
That's where it becomes more personalized. If you've had, say, PCV13 before, or maybe PPSV23,
Right.
your doctor or healthcare provider needs to look at your specific history. They'll help figure out if getting one of the newer, broader vaccines like PCV20 or PCV21 makes sense for you now.
It's not automatic.
No, it's not about just replacing what you had. It's about seeing if adding a newer vaccine gives you better, broader protection now. It's really what we call shared clinical decision-making. You talk it through with your provider. There are also minimum time intervals to consider between doses.
Okay, shared decision-making, that makes sense. So if we were to sort of distill this all down, what are the main takeaways for people listening?
I think the key things are these newer vaccines, PCV20 and PCV21, offer broader protection against more strains. That's a clear benefit.
Right, broader protection.
And most adults 50 and older should definitely consider getting vaccinated. Plus, crucially, adults younger than that 19 to 49, if they have those specific health conditions we mentioned, they need to be covered too.
And the single most important point, if there's one thing people remember,
it has to be this. Talk to your doctor. Honestly, your own doctor or healthcare provider is the best person to figure out the right vaccine and the right schedule specifically for you. Discuss your history, your health, get that personalized advice. It's really the only way to be sure.
That seems like the crucial step. So thinking about all of this evolving science, what does it really mean for your health journey? It feels like considering these options, having that conversation with your doctor, is a really powerful step towards, proactive well being.